Commissioner, thank you for the depth of your testimony and for the breadth of your work and that of your team. It really is quite commendable.
The team, for sure.
Totally. And you've made that clear, and I really appreciate that. And I really also, I won't ask about racial and maternal health because so much of it has been covered, but I want to recognize the importance of that work to you and then clearly to our colleagues. So thank you. I want to focus, and I don't think you're going to be surprised, on public health infrastructure, on the regional and local boards of health. So I heard you say, very happily, public health infrastructure, you're seeking one that's modern and accessible. You talked about building the capacity of local and regional public health. You talked about necessary training and data work. And you said, and I am too, that you were astounded and amazed by the kind of change, I think, sea change we've seen. I want to recognize the administration's work on that. I think you've moved with great speed and I think diligence. And I want to recognize that our colleagues in the legislature continue to prioritize funding. And it's a great partnership. And 320, that's a new number. I thought it was 311 of the 351 cities and towns are now in some sort of regional service sharing agreement, which is, I think, just something to be, for all of us to be exceedingly happy about, right? And it is the way forward. So here I have a two-part question. What's the next step for the administration to build on the foundation that you just told us about? And what should the legislature do to continue demonstrating our commitment to local and regional public health and the public health excellence grants?
Thank you. Thank you for that question. And thank you for your longtime support of local public health. It is well known to many people across the 351 cities and towns. I believe that we have a fantastic system of local public health in Massachusetts, albeit one that is incredibly unique here in this Commonwealth. Because of the way the system has developed, we do not have a way to non-competitively fund local public health across Massachusetts. And that puts many of our communities, whether they be large cities, gateway cities, or rural areas, at a disadvantage because they don't have the resources that they need to staff up appropriately and to maintain those staff, to train those staff. And as the legislature has put forward, SAFE 2.0 is a necessary next step in local public health. It is a pathway to creating an accountability structure for local public health. It is a pathway to codify many of the recommendations from the Special Commission to create a blueprint on local public health. And it's a pathway to that non-competitive funding. Subject to appropriation, we can make sure that local public health is able to achieve what we need it to achieve, to be ready and prepared, to be equity-minded, and to make sure that in every community, no matter where you are, you have access to the services that you need. And so I see this not as an administration problem or a legislature problem, but one which we can collaborate together and cooperatively find the best way to fund and support local public health.
So I that's very interesting, very heartening, I think very informative for us to hear as a legislature. You know, we have a bill pending that we can and should act on. And I certainly support that. I also wanted just to bring it back to something that Senator Friedman said, when she was welcoming you, which is that the COVID pandemic showed us the glaring inequities that we had and in some cases still are struggling with your leadership to overcome. And that this is not only a rural equity piece of work, it's a racial equity piece of work, it's a 351 cities and town equity piece of work on top of the preventative and strengthening of protections for our folks and local communities. So thank you so much.